There's anything this planet needs. It's a big double armful of peace. And plant-based nutrition is a ticket for all of us to become more healthy and for this planet to become more peaceful. So thank you for the invitation to be here. Thank you for putting on this conference. Thank all of you for devoting some of this beautiful day to opening your heart and your mind and advancing on your own journey towards better health. So I'm the guy to talk a little bit of science with you as far as why this works. It's not enough to just take our word for it. Eat healthy, eat a lot of plants and you're going to get healthier. Yeah, okay. But we see it, and as the physician, I have to ask, why? What are we looking at? Why does a plant-based diet make people healthier? So let me share that with you so you've got even more conviction as you push that cart down the supermarket aisle or you order your meal in the restaurant. You'll know why a diet on whole plant foods really is the best for your body. So what I'm going to be talking about here is some of the improvements that we see in chronic disease. What are we talking about when we talk about a whole food plant-based diet? I think all of you know well, but we'll just show you some pictures. To understand why a plant-based diet helps, we have to talk about why the current Western diet is so bad and so disease-producing. So we'll draw a little bit on that. Then exactly what happens in the body when we adopt a plant-based food stream. And I'm going to then zero in on two particular diseases, the most common health problems that most folks in this room have to deal with. Now, there's clogged arteries in the form of atherosclerosis as well as type 2 diabetes. And then to take a quick trip through the literature to show you there is a growing body of scientific validation on so many diseases that we were told had nothing to do with diet. Well, actually a plant-based diet is the key to reversing so many of these conditions that some of you may be struggling with on this day. So that's going to occupy the next 40 minutes. I learned how the plant-based diet can produce these remarkable changes while serving on the staff at TrueNorth Health Center in Santa Rosa, California, about an hour north of San Francisco. I was privileged to be on that staff for almost 9 years. And what I saw there changed my whole viewing of medicine and the human body. The diseases that people bring to TrueNorth are the same diseases that most every family physician who opens the door of the waiting room, plus every emergency room doctor looking at who's waiting to see them, every surgeon and surgical outpatient, pick a disease, pick a specialty, pharmacy, dentistry, nursing, they're all dealing with the standard Western diseases that most Western folks in that diet and lifestyle find themselves struggling with. Most of our patients at TrueNorth were either clinically overweight or actually obese. We saw clogged arteries showing up as high blood lipids, high blood pressures, angina, claudication of leg pain when you're walking. We saw rampant type 2 diabetes and inflammatory conditions of every organ in the body, lungs, intestines, joints, immune system. This is Western medicine in the 21st century. This is what all physicians are struggling with. And it pains me. It's exquisitely discomforting to know that the solution to these doctors is as close as our patients' dinner plates, and we're trying through our Moving Medicine Forward initiative to get that message across. So when people came to TrueNorth, and when they still come to TrueNorth, it's certainly still functioning. We do not do the usual treatment of raising their dosage of insulin and beta blockers and prednisone. Instead, we give them a diet based on whole plant foods. What does it look like? It looks like this. Every morning, there's a big pot of oatmeal porridge for those folks not raised in the U.S. here. There's plenty of fruit and sunflower seeds and slivered almonds to put on the oatmeal. And every lunch has a big hearty green salad and a nice vegetable-filled stew or vegetable soup. There's always big plates of steamed green and yellow vegetables. and a host of hearty main dishes, curries and stews and soups and casseroles and no cheese burritos and no oil stir fries, and plenty of fruit for dessert. This is the food stream that we want these folks to run through their body, meal after meal, day after day, week after week. This is what does the magic. This is what our body's looking for, and this is the secret sauce, if you will, that produces these fabulous clinical improvements in our patients. And what we see is truly astounding. Things that I thought never happened happen right before my very eyes. The obesity begins to melt away on day one. It doesn't instantly vanish, but folks, especially as the water and bloat leaves their tissues, they'll lose 3-4 pounds in the first couple days. But then it averages 2-3 pounds a week steadily. The blood vessels, the arteries begin to relax and dilate a bit. That lowers the pressure in the system, so high blood pressure starts going down. We can lower the dosage of medication people are on. Inflammation all over the body starts to subside, and inflamed joints, skin, lungs start getting better. I was making rounds one morning. A woman had been there for a good couple of weeks, and she had rheumatoid arthritis. And I walked in, she had tears going down her cheeks. And I said, good heavens, are you okay? Are you in pain? She said, no, this is the first time I've been able to make a fist in 10 years. I've never seen my hands work like this. And again, on no medication, just healthy plant-based food. Constipation gets, these people have the first good bowel movement in years, and it does wonders for their entire outlook, let alone their digestive system. We see eczema, acne, psoriasis start getting better day after day to see these plaques of psoriasis that in outpatient medicine takes weeks and months to disappear. In days, especially on a water fast, you see these plaques fading right before your eyes. And I've never thought that I would see that. The asthmatic folks stop wheezing so much, they stop using inhalers. The migraine headache folks say, gee, I haven't had a headache since I've come through the door here. That's right. And the sleep becomes more restful. And we find the medications that folks came in with for high blood pressure, for insulin, for their blood sugar, they're too strong. And they're standing up and getting lightheaded and passing out because their blood pressure pills are too strong. So I say those words I was told never to say, stop your blood pressure medication. As soon as I said those words the first time, I expected to see a puff of smoke, and the ghost of my internal medicine professor showed up. What'd you say? Stop medication? Nobody stops blood pressure. These are lifetime medication. Give me your stethoscope. You're no longer a doctor for transgressing this sacrosanct device. Well, of course, no puff of smoke happened. When I said those same words to my patients with diabetes, stop your insulin. I looked around and no puff of smoke. They didn't need the insulin anymore. They weren't diabetic. This is disease reversal. I practiced medicine for 30 years before anybody put those two words in a sentence for me, that these are reversible diseases. I wish someone had told me that in medical school, that hypertension is reversible, that type 2 diabetes is reversible. It changes everything. And I'm trying to get that message into the minds of the medical students we talk to before pharmacosclerosis sets into their brains, and they think that drugs and surgery are the only treatments for these conditions. When we're talking about disease reversal, two things. We're talking about remission of clinical symptoms. Their joints stop hurting, their lungs stop wheezing, their body gets better, but also their laboratory results that were terribly too high, too low, they normalize as well. So when we talk about disease reversal, it's not a woo-woo California concept here. We're talking about remission of clinical symptoms and normalizations of laboratory results, and we see this on a consistent basis. So as I became a student of the benefits of plant-based nutrition, I began seeing journal articles showing up consistently focused on these 9 major conditions. And we'll be visiting them again, and we're going to, as I said, spend the most time on reversing artery disease and type 2 diabetes. But all these conditions, and we're going to do just a quick hop skip through the literature showing you some of the studies showing how reversible with plant-based nutrition these serious conditions are. So the question is, why does it work? How does it work? How does a plant-based food stream work its magic? Well, to understand, an automotive analogy might help. If you are driving your Honda Civic or some other car that has a nice gasoline burning engine in it, and you notice that the gas gauge is saying you need a fill-up, and you pull into the gas station, but as you pull in to the service station, you notice that the diesel fuel is 6 cents a gallon cheaper than the gasoline. And you say, I could save some money here. And you decide that from now on, when it's time for a fill-up, I'm going to fill it 2/3 up with gasoline, but the last third I'm going to top up with diesel fuel. And boy, I'm going to save some money as the years go by, surely. Well, diesel fuel is kerosene, basically. It's oily. It does not burn cleanly in a gasoline burning engine. And you put a mixture of 1/3 diesel fuel into your gasoline burning engine's gas tank, and the results are predictable. You're going to have a whole bunch of black smoke coming out of the exhaust and unburned fuel. There's going to be black carbon deposits caking up on your spark plugs. The exhaust manifold is going to clog up, and the catalytic converter will be fouled. And pretty soon you open the hood and you've got the situation this woman is facing. And at this time, she, in the classic American medical rationale, she reaches the logical condition: my car has developed a disease. The car did not develop a disease. That engine malfunctioned precisely, predictably, as it will malfunction by putting the wrong fuel in that it was not designed to run on. If you will, there's been a transgression of natural law. The natural law in this case is that gasoline burning engines are meant to run on gasoline. That's law. You transgress that law with kerosene fuels, and there's going to be dysfunction and eventually damage to the machinery. Is there an analogy with our body's metabolic engine here? Well, what is the natural fuel that our bodies are supposed to run on? When I have that question, I, in my mind, consult my foremost expert and authority on plant-based eating, Professor Rwanda here. And because basically we have essentially the same digestive systems that our gorilla and bonobo cousins have. And they're up in the tree shoving leaves and fruit and vegetation into their mouth all day. They live on a high fiber, high carbohydrate, plant-based diet. And guess what happens to these folks? Well, what doesn't happen to them is developing clogged arteries. These gorillas in the wild do not develop atherosclerosis. They do not develop type 2 diabetes. They do not develop ulcerative colitis. They die of trauma and infections and parasites, but that's gorillas' life challenges there. But they don't develop the so-called diseases of civilization that we do. So, do we take the lesson from these stalwart exemplars of plant-based eating and eat a whole food plant-based diet? Not so much. We get seduced by the salty, sugary, meaty textures in our mouth from the standard Western diet, and so a steady stream of meat and cheese and oil and sugar and processed foods and fried foods goes down our gullet meal after meal, month after month, year after year, and our metabolic machinery suffers similar damage. So I wish when I was a medical student, some professor, some chief resident sat me down and said, listen, before you go out and deal with these river of patients in outpatient clinic here, let's get real about why Mr. and Mrs. America is sitting in front of you overweight, diabetic, hypertensive, clogged up, and inflamed. It's from what they're running through their arteries every 4 hours. It's from their frickin' diet. When you eat a diet based on standard Western fare, bacon and eggs for breakfast, cheeseburger for lunch, chicken for dinner, ice cream for dessert. And I know not all of you are eating in this style, but most Americans eat one or more of these kind of meals once a day, and many of them, this is their standard fare. What happens when you eat a meal like this? Well, to contrast it, if you eat a meal based on whole plant foods like we are suggesting, and you have that nice salad and bowl of vegetable soup and steamed veggies and fruit for dessert, you have a meal like this. And if an hour later I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, I drew 5 cc's of blood into a glass top tube, let the blood clot, put it in the centrifuge and spin it down, and had a look at it, what we would see is the tube on the left here. This is how your blood should look after a meal. And you can see the serum that rises up to the top, crystal clear. You can read newsprint through normal serum. This is what your blood should look like after you eat a meal. But you have a standard Western meal full of meat and dairy and eggs and oil, etc. And if an hour after one of these meals I sneak up on you with that syringe and draw 5 cc's of blood and spin it down the centrifuge, what I would see is blood that looked like this. This cloudy material here, this is fat in the blood. The technical term is postprandial lipemia. Postprandial means after eating, but lipemia is fat in the blood. This is fat in the blood that shows up after a fatty meal. And this is basically triglyceride, saturated fat, and cholesterol. It's the fat of the animals the person ate. Now, I'll grant not everybody shows the fat this optically densely, but everybody has a wave of fat that goes through your bloodstream when you eat a fatty meal. How can you not? Where else is it going to go, of course? And your blood stays fatty for a good 5, count 'em, 5 hours. This is Kuo's classic study. They gave someone a fatty meal at hour 0, and they drew blood once an hour for 6 hours, and they took those 6 blood tubes and put them one after another into an instrument that measures how fatty the blood is getting. And you can see the blood getting fattier and fattier and fattier. It takes the liver about 5 hours to begin to clear the fat out of the blood. So bacon and eggs for breakfast keeps your blood fatty all morning. The cheeseburger for lunch keeps your blood fatty all afternoon. Chicken for dinner keeps it fatty all evening. And a little ice cream for dessert sends you to bed with your blood filled with fat. And when your blood is running thick with fat, your lipids are getting worse, your bad LDL is going up, but the blood is getting thicker. The red cells start sticking to each other. The blood becomes more viscous, more thicker. And it's harder to push viscous blood through tiny capillary beds. So oxygen delivery goes down, nutrient delivery goes down. As the fat in the blood goes through the abdominal fat stores, it sticks there, and abdominal obesity increases. And this in turn, as I'll show you later, leads to insulin resistance and high blood sugars. And these saturated fats are pro-inflammatory. They fan inflammatory reactions throughout the body. So for 5 hours after every fatty meal, your lipids are getting worse, you're getting more obese and inflamed and more insulin resistant. Meal after meal, day after day, month after month, year after year. So I've focused on the fat because it's the most visibly apparent, that lets you know how long the effect is having on your body. But there's more than just fat in that blood if you're eating a standard Western diet. It's a high salt diet. There's salt in the meats and salt in the cheese, salt in the sausage, salt on the fries, salt in the chips, salt in the spaghetti sauce at the Italian restaurant. It's in the processed foods, and you can't do anything about it. It's already in these processed foods. And we know, of course, from long experience, that a high salt diet penetrates into the walls of the arteries and stiffens them. It makes the kidneys retain water. That increases the blood volume. Both those effects will raise the blood pressure. That sets up the person for heart attacks and strokes and congestive heart failure. But also, it's come to light in recent years that high salt diets stimulate Th17 helper cells. And these are immune cells that open the door to autoimmune diseases like lupus. Who knew that a high salt diet invites autoimmune diseases in? But we now know that. And as a recovering saltaholic myself, I have to find new ways to entertain my tongue with non-salty flavorings, so I become adept at using lemon juice and balsamic vinegars and non-salty seasonings, and pass that along to you because you don't want to be eating a high salt diet either. Most Americans eat twice as much salt as they should on a good day. Then there's sugar. Everybody's got a sweet tooth, and we all like that flavor on our tongue. And I'm not talking about a half a teaspoon of sugar in your tea as a flavoring. That's how sweeteners are supposed to be used, as a flavoring. I'm talking about eating sugar as a food. When you are eating a donut, a cupcake, a piece of coffee cake, a candy bar, you drink a cold drink, you are flooding your body with grams and grams of fructose, maltose, dextrose, and these sugars stick to proteins all over your body. It glycosylates the proteins. And these sticky proteins then oxidize in your body heat and produce what's called advanced glycation end products. Don't worry about the name. Remember the acronym. These products age you. These again are the sugar-laden proteins that get oxidized by your body heat or get oxidized in the preparation, making potato chips. Drop potatoes into hot boiling oil, and you're going to create lots of these advanced glycation end products. And again, eating sugars as a food produces these AGEs in tissues throughout the body. You don't want to run this AGE producing reaction in the crystalline proteins of the lens of your eye. It's a great way to open the door to cataracts. You don't want to run the AGE reactions in the elastin fibers of your skin. Great way to turn your skin into an old suitcase. And you sure don't want to run the AGE reaction on the inner lining of the blood vessels of your brain. And here's why. These are the brain arteries of two men who died at the same age. The man in the upper panel did not have Alzheimer's dementia. The man down here did have Alzheimer's dementia. And you can see the arteries to this man's brain are thickened and swollen and edematous and inflamed. And if you stain for these AGEs, you find that these arteries are filled with them. Alzheimer's disease has a major blood vessel, major vascular component to it. Alzheimer's is not something that falls out of a tree on you at age 80. This is 80 years of running meat and dairy and oil and fried foods and sugars and processed chemicals through these arteries bringing blood to your brain. There's a huge vascular component to Alzheimer's. No one really should get this disease. You look at the Blue Zone folks. I hope you've seen Dan Buettner's TV series. And you see these lovely 100-year-old women in Okinawa, and they're laughing and working in the garden, and everyone treasures them as members of the society. That's what aging is supposed to look like. They don't have arteries that look like the man below here because they've taken care of them through their lives. So I paused here to just emphasize that vegan junk foods, all the sugar snacks and the salty snacks and the oily snacks, even though they're vegan and they're plant-based or they originally came from plants, so, oh, I'm vegan, I'm healthy. No, not necessarily. This is why we're using those terms whole food, plant-based. You want foods that you could recognize if they were growing in the garden. Oh, there's a cucumber. Oh, there's a strawberry. That's what you want to be eating. Nothing on this slide here is a whole food, plant-based food, even though it's all vegan. And this is what trouble looks like without animal products. So that said, most people in this country, certainly most Americans that come to their doctors, are not vegans. There's a piece of animal flesh in the middle of every meal that they eat. If there isn't, you call the waiter over and say, hey, where's my protein? And as a result, the bacon at breakfast, the burger at lunch, the chicken for dinner. What does this put through the bloodstream after every meal? I showed you how long the fats affect. Well, what's in that blood besides fat? Well, I'm going to quickly run through these 9 issues with meat. I know time is of the essence here. First of all, no one eats raw meat. The very act of grilling the burger, broiling the steak, frying the chicken oxidizes the cholesterol in the animal's muscle, and it's the oxidized cholesterol particles that go into the walls of the arteries, setting off atherosclerotic plaque formation. You broil that steak, grill that burger, you're going to be oxidizing the glycogen and nucleic acids in the animal muscle. That in turn makes these reactive aldehydes like acrolein, glyoxyl. These are mutagenic. They damage your genes. These are the genes in your DNA that call forth the enzymes in your cells that do all your biochemistry. Well, these aldehydes damage your genes after every meal. Why eat a food that floods through your tissues and damages the cells in the genes in your cells? Nu-5GC, this is a sialic acid that only animals make, and it sets off inflammatory reactions throughout the body, and our paleo friends are giving themselves a shot of Nu-5GC with every meal. Endotoxin comes from the gut bacteria in the carcasses of the animals that spill out during the processing at the meat packing plant, the bacteria coat every steak and chop and chicken breast that leaves the meat packing plant. And in the meat case at your supermarket, the ultraviolet light shines down, kills these bacteria, their cell walls break apart and release this nasty chemical called endotoxin, makes your blood clot, depresses your heart, releases histamine, releases free radical, really damaging stuff, and makes your gut leaky and lets food proteins leak into your bloodstream. And endotoxin is heat stable. Grilling the burger does not get rid of the endotoxin, and boiling the hot dog doesn't get rid of the endotoxin. And again, our paleo and our keto friends are giving themselves a shot of endotoxin 3 times a day. TMAO is a molecule that the gut bacteria that grow in response to meat and eggs in the diet, they produce this molecule that drives cholesterol into your artery walls. Grilling that burger, broiling the steak inevitably produces carcinogenic cancer-causing chemicals that smear on the stomach wall, giving gastric cancer, smear on the colon wall, give colon cancers. When you eat meat and all the amino acids flood up into your liver responds by putting out a surge of IGF-1, insulin-like growth factor 1. This is one of the most powerful growth-promoting hormones in the body. And it's great if you're an 11-year-old growing girl or a 12-year-old boy, but if you are an adult woman with an early breast cancer, or you are a guy with a big prostate and some malignant cells in the middle of it, the last thing you want is a diet that makes you walk around with high levels of IGF-1, but that's exactly what a meat-based diet does. Heme iron makes red meat red. It also increases the risk of strokes and cancers. Don't have time to get into the mechanism. And finally, the animals being fattened for slaughter in the feedlots are fed bushels of grains that are sprayed with herbicides and pesticides. They're given antibiotics and growth promoters to make them fatter. They drink water with lead and cadmium and mercury. All of these toxins accumulate in the animal's muscle. And when you bite into that burger or that chicken breast, you're eating all the bioconcentrated contaminants that animal consumed. This is what floods through the tissues with every meal. I call it the postprandial red tide. And it's these are just some of the components. I could spend 2 lectures going through this list. It's a fatty tide, it's a salty tide, it's a sugary tide. It's antigenic, sets off immune reactions. It's full of phosphates and sulfates that produce acids in the body. It damages your genes, it sets off cancers, it clogs your arteries, sets off inflammation, disrupts enzyme reactions throughout the body. This is what a meat-based diet surges through all your tissues hour after hour. No wonder people come to the doctor, overweight, diabetic, hypertensive, clogged up and inflamed by putting this diesel fuel, if you will, in their gasoline-burning engines. You eat 3 times a day, that's these kind of meals, it's over 1,000 times a year you are flooding the red tide through your tissues. And the food effects over time equal the health effects. Within minutes of eating anything, molecules of that food are flowing through every cell in your body where your DNA lies unfolded and your genes are exposed. And the food molecules wash over your DNA and they play your genes like a piano. And they turn genes on, they turn genes off. They induce enzymes, they shut enzymes down. Every meal brings in not only nutrition and nutrients, it brings in information. And every meal changes us on a genetic molecular level. And you don't need to be a geneticist to understand that the genes are going to be turned on by this broiled steak with all the endotoxin and Nu5GC and AGEs and all of that. The gene's going to be turned on by these toxic molecules, which we know are the genes that drive aging and inflammation and autoimmune disease and cancers. Those genes turned on by this broiled piece of animal muscle are going to be a totally different set of genes than are those that are going to be turned on by this green salad. And that floods the tissues with these phytonutrients that are antioxidants, that are stabilizing, that promote tissue repair, that promote membrane stabilization. They give the chemical message to your tissues, calm down, everything's okay, this is what you're supposed to be running on. Your genes may load the gun, but your diet and your lifestyle pull the trigger. Okay? You may have a genetic propensity towards a disease in your family, but whether that disease actually manifests in your body, largely, not completely, there are other factors, but largely depends on what you're flowing through your cells every 4 hours, month after month, year after year. And to see how dramatic this effect is, this is the genetic readout of a man with early stage prostate cancer. This left-hand panel, when the prostate cancer is active, all these red dashes here, these are active oncogenes. These are genes that promote cancer growth. And you can see how many of them are bright red and actively promoting his prostate cancer. Man goes on a plant-based diet, and week after week of salads and soups and steamed veggies and healthy, colorful fruits, etc. And 6 months later, they do another biopsy. Same man, same prostate, same genes. But look and see how many of these red, angry oncogenes have now turned green, have been silenced. This is epigenetics at work. This is just because you have these genes, are they active or not? That's determined largely by the food that you eat. So this should be empowering to you, and every doctor should be sharing this with their patients. You have the power to change your very genetic expression given the foods that you eat. And again, Professor Rwanda doesn't have to deal with all these red, angry oncogenes. Food changes us in 2 ways. Either directly, the way Nu5GC turns on inflammation, but also the food we eat changes the microbes in our gut, and they will change us by their byproducts of neurotransmitters and inflammatory mediators. Food is so powerful. We use it as a recreational activity, but the truth is it's a tremendous determinant of what we are seeing as far as health goes. And I tell the medical students, when you open the door to the exam room and the patient's sitting there and the man with the chest pain from his angina, the lady wheezing from her asthma, the man with diabetes injecting insulin, the woman grieving over her acne-scarred skin, you ask the professors, what are the cause of these diseases? You run into 2 words, etiology unknown. We don't know the cause of high blood pressure. We don't know the cause of type 2 diabetes. And it's true, we've not teased out every last genetic enzyme interaction. There's a lot to learn in that world. But to say that we have no idea what is driving these diseases, I think is a gross misrepresentation and is ethically unfair to the patients, to say the least. The food effects over time equal the health effects, and yet it's never mentioned in medical education. We're trying to change that through moving medicine forward. So of these conditions here, I want to focus on a couple of them, but before we do, let's talk about how a plant-based diet actually works its effect. Why does it work? How does it work? Well, here we are, the man or woman is still eating the standard American diet, the burgers and buffalo wings and pepperoni pizzas, and finally they get out of the shower in the morning, they catch a glimpse of themselves in the mirror, and they don't like what they see. They don't like what they feel. They don't like that medicine cabinet full of pills. They don't like their big belly. They don't like where their body is going. And they reach that point, like the heroin addict who's just found themselves on the bathroom floor too many Sunday mornings, finally say, I got to change something here. And they go to the doc, tell me what to do. I can't do this anymore. What's my first step? And the physicians, like we have a number of them here, know just what to say. Well, first, square one, adopt a whole food plant-based diet. Stop the animal products, stop the processed foods. You want to eat only things that grew out of the garden. And the person says, okay, doc, I'm committed. Boots in, like they say in New Zealand, and he does it. And the salads and the soups and steamed veggies now make up the bulk of what he's eating. Look what happens. First of all, this constant stream of red tide marauder toxic molecules, gone. There is respite. Every cell, every tissue in your body knows how to heal itself. Do you know you have DNA editing enzymes, proteins that go up and down your DNA strands looking for damaged genes and mismatches, and they know how to repair your DNA. But they can't do that amazing repair job if every 4 hours you're running meat and oil and dairy and salt and sugar and processed foods through it. That thwarts this wonderful healing mechanism that we have. Well, now cellular healing can begin. And now look at what happens. Instead of the red tide flowing through the tissues, look what happens. First of all, it's a high water content diet. All the soups and the salads and the steamed veggies and the fruits, they're full of water. And so with every meal now, there's this surge of water that goes through your tissues. And it flushes out impurities, flushes out old oxidized starches and junk proteins. It's like taking your cells to the car wash. And you wind up cleaner on a cellular level. But not only that, with all the water in the blood becomes less viscous. It flows more easily. And less viscous blood can now surge through the tiny little capillary beds, bringing oxygen and nutrients to the tissues. And coupled with the less viscous blood is the fact that all these dark green leafy vegetables you're now eating increase the production of nitric oxide in the walls of the arteries, and that produces a very subtle dilation of the arteries as they relax and open up. Well, this not only lowers blood pressure, but thanks to a law in physics called Poiseuille's law that says that even just a small increase in the diameter of the blood vessel means a big increase in blood flow, goes up by the 4th power of the increase of the radius. So now there's this huge surge of blood, of less viscous blood flowing through all your capillary beds in your brain, your heart, your muscles, your kidneys. That alone is healing. When you go from an animal-based diet to a plant-based diet, you're pulling out the arachidonic acid. This is the major molecule that drives inflammation throughout the body. Poof, gone. Now, all the fats in your diet are coming from plant oils. And many of them are in the omega-3 category that are anti-inflammatory. So you've changed the entire inflammatory balance in all the tissues of your body. Where first it was a seething cauldron of inflammation, now it's a sedate green pasture with blue skies and butterflies as far as inflammation goes. All the fried foods and sugars produce a lot of free radicals, ROS here. Well, all these colorful fruits and vegetables are full of antioxidants that quench the free radicals, so the oxidative damage in the tissues subsides. Change the food stream, you're going to change the microbes in your gut. If you're eating meat and eggs, you are fostering the growth of some really nasty pathogenic microbes from the Bacteroidetes family. Well, pull out the meat, stop feeding those guys, and now you're putting in the beans and the lentils and the chickpeas and the greens and the fruits. And now you're going to promote the growth of the Prevotella microbes. These are much friendlier fellas. And their byproducts are anti-inflammatory, and they stabilize the cells instead of promoting cancer. When you stop eating the cholesterol of other animals, your own cholesterol is going to get better, so blood lipids get better, and chances of promoting plaque formation goes down. Your skin oil is going to change. The fats in your diet works their way out to your skin oils, and guys who eat a lot of meat find their body odors reminiscent of the Green Bay Packer locker room at halftime. Well, many guys have come to me and said, gee, Doc, ever since I went plant-based, my wife says I don't smell anymore. Yes, that's true. That's one of the things that happens. That's another validation of what is changing in your body. Hormone levels normalized. You know the cows in the dairy are now all pregnant. They are sucking the milk off pregnant cows. Didn't used to be that way, but they can't afford to have their best milkers go off their line for 9 months while they're carrying their calves. So now they've genetically modified the cows, so they're still carrying their next calf, but now they're still giving milk and they're sucking milk off. So the milk is full of estrogens, and these are not the puny little phytoestrogens in soy. This is estrone, estradiol, estriol, pregnanediol, progesterone. These are official mammalian estrogens that drive breast lump growth in women, prostate cancers in men. Well, stop the dairy and prostate and hormone levels normalize. Kidney function gets better. High protein diets, yay, no, not so yay as far as your kidneys go. High protein diets are stressful to the kidneys. All those amino acids slam into the filter membranes, and it puts them in a state of what's called hyperfiltration, and that, as the months and years go by, leads to kidney failure. The asthmatic folks don't wheeze so much, their lung mucus gets thinner. White blood cell counts go down for a good reason, not from disease, but their white cells can just eat up germs more efficiently. These are just a modicum of the changes that happen in all the tissues of the body. And if the students ask me, Doctor, what changes in your body when I go from an animal-based diet to a plant-based diet? In a word, what changes? Everything changes. And the person is an entirely different metabolic creature. Pick a parameter, whether it's their oxidative stress, their inflammatory markers, blood viscosity, everything changes. No wonder as the ship starts metabolically righting itself, how we see these wonderful improvements in these conditions. So I could spend 2 lectures just going through each of these organ systems, talking about the improvements on a plant-based diet. Well, am I going to get enough protein? Absolutely. There's plenty of protein in the beans and peas and chickpeas and lentils and seeds and nuts. A day of eating these kind of foods can easily give you a good 80 grams of protein. Protein deficiency really should not be a problem. You want extra protein, have another hummus sandwich or another scoop of lentil stew. So we're getting to the end, and I may not be able to get through all of this. I was going to drill down on how the plaques will melt away. This is what usually happens in America 1,000 times a day. Americans drop dead with heart attacks. And the artery linings are getting damaged from the cooked meats and the fried foods and the fryer oils and the uric acid, etc. And the oxidized cholesterol that I mentioned from cooking the animal muscle gets into the wall of the artery, and the plaque is produced. Most cardiologists say, oh, this is relentlessly progressive. Once you get angina, there's nothing but a stent or a bypass for you, because that's what they see. And God forbid they actually talk to their patients about changing their diet, but they don't ever do that. And so, yeah, all their patients need stents and bypasses. But actually it can be a reversible disease, as Dr. Esselstyn has made very clear. And a remarkable study that he did, he took almost 200 men, every one of them were all clogged up. They all had angina, they had heart attacks, they all had stents. These were all severe vascular disease patients. Put them on a whole food plant-based diet and lots of green vegetables, and he watched them for 4 years. During those 4 years, statistically, 60 of these 200 men should have had a major adverse cardiac event, a heart attack, a stroke, etc. None of them, after 4 years, had any one of these events. And the folks who had bad chest pain, angina on walking, 9 out of 10 of them, their angina improved or went away. This is so profound. Every cardiologist would say, stop the presses, tell me more about this. But we hear crickets from that community, unfortunately. Lots of green vegetables he wants you to eat, because the green vegetables seep into the wall of the arteries, neutralize the free radicals, the foam cells making up the plaque, they out-migrate and leave, and the plaques get smaller and smaller and smaller. And the endothelial lining reestablishes itself, not by magic, but because the bone marrow is constantly putting out showers of stem cells that reupholster the artery walls. And you've probably seen this classic angiogram. This is the artery in a man's heart, the left anterior descending artery. It's filled with angiography dye. The entire dye column should be about this wide all the way down, but this rat-eaten portion here, these are atherosclerotic plaques encroaching into the blood flow channel. He had severe angina when he walked, did not want statins, couldn't be bypassed, went on a whole food plant-based diet, month after month of salads and soups and steamed veggies. The plaques melt away, and 29 months later, this artery turns into this artery. Same patient, same artery. Look at the reversibility of this disease. Absolutely stunning. A little balsamic vinegar dilates the arteries, and again, Poiseuille's law kicks in, and you wind up getting perfusion scans. This is a heart scan. Red is good blood flow. You can see how choked off the blood flow is here. 2 weeks on a plant-based diet, the arteries relax, Poiseuille's law kicks in, and this perfusion scan turns into this perfusion scan. This is how quickly you can get this kind of response. Saw this study in 1977. A man with severe angina went on a plant-based diet. 6 months later, he's climbing mountains in the Lake District in England. This is how profound and quickly a plant-based diet can exert its beneficial effects. And arteries all over the body open up, much to the delight of people at home. Just a quick literature survey. There's getting to be a vast literature documenting the reversibility of these diseases with a plant-based diet. High blood pressure, heart failure, kidney failure, they can all improve with a whole food plant-based diet when you stop binging them every 4 hours. And forces the doctor to learn this lovely skill called deprescribing. These drugs are now too strong for the patients, and you got to get them off their blood pressure pills and their statins. And there's an art to doing that that lifestyle doctors know, and Dr. Chawlas know well how to do this. Anyone would like my 4-page handout that I give to all my patients on healthy eating, go to my website, drklaper.com, go to answers, and download the health supporting eating plan. Dr. Chawlas have this link here. Diabetes, same way. In 1927, Dr. Sweeney at Yale showed the cause of type 2 diabetes. People think, oh, sugar, don't eat sugar. And that's true. If you have diabetes, you don't want to eat too much sugar. But that's not the cause of the high blood sugars. The problem is the fat in the diet. And it was showed by this study. He took 2 groups of medical students. One, he put on a high carbohydrate diet for 2 days. The only thing he let them eat were white sugar, candy, pastries, white bread, baked potatoes, syrup, bananas, rice, and oatmeal, a high carbohydrate diet. After 48 hours, 2 days of eating that high carbohydrate food, he did a glucose tolerance test. He gave them 100 grams of glucose to drink, and 2 hours later checked their blood sugar. If everything's functioning normal, the blood sugar should be back down in the 100, 110 range, the non-diabetic range. And indeed, after eating all that sugar for 2 days, these young med students, the vast majority of them were back in normal blood sugar range. But the other group, he put on a high fat diet for 2 days. The only thing they ate was olive oil, butter, mayonnaise with egg yolk, and 20% cream. 2 days later, he gave them that 100 grams of glucose, and every one of them had elevated blood sugars. They all went in the diabetic range. It's the fat clogging up the insulin receptors that cause the problem. Keep your blood fatty all day, and the fat oozes into your blood as intramyocellular lipid oozes into your muscles. And what happens, and this is not theoretical, here's what it looks like under the microscope. This is striated muscle in your arm. And this black stuff, this is fat in the muscle cells, should not be there. Under the electron microscope, again, fat in the muscle cells should not be there. And what it does is clog up the insulin receptors on the inside. This is a simplified version of it. And if you happen to have, and there's getting to be a literature supporting this, but if you happen to have an obese abdomen, that's making things worse because the fat in the abdomen is putting out these inflammatory molecules and inflammatory cytokines. And it's a real thing, obesity-related inflammation. People say, well, I'm obese, but that's your problem, doc. I'm body positive, and don't talk about my weight because you're fat shaming. And that's a whole issue. And I honor the difficulty of that. But the issue is obesity is a state of inflammation, and the inflammatory markers interfere with the insulin receptors in the outside. No wonder so many obese people develop type 2 diabetes. It's a reversible disease. You go on a plant-based diet, you burn the fat in the muscle cells, and the cytokines go away, and people improve. We all have patients like Jim who shakes his diabetes. We get rid of the diabetes. Obesity melts away. This food is mostly fiber and water. Inflammatory diseases get better. Again, there's a whole literature. Autoimmune diseases get better, like lupus. If you have lupus, get Dr. Brooke Goldner's book, Goodbye Autoimmune Disease. Learn how she reversed it on a plant-based diet. Crohn's disease and colitis gets better as well. Asthma gets better. Psoriasis and other skin conditions. And yes, medical school never mentions this. We just blow right past it. What drug, what surgery? Disease reversal is where healing begins, and the Drs. Chawla here know all about it. So I urge you, take advantage of this brilliant guidance that you're going to get in their program. There are plant-based dietitians all over Houston who will also help you get on the right plant-based journey. So it's the most powerful modality that any physician can wield. It beats any drug or surgery that they're ever going to learn about. People do change despite the cynicism of my profession. So I'm at the end. They say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And when I go talk to the medical students as part of moving medicine forward, I said it's the food your patients are eating. And I asked them a provocative question. Knowing how reversible these diseases are that you're going to spend your majority of your career treating, you want to heal these patients, or you just want to manage their chronic disease? You want to heal these people, then get real about why they're sitting in front of you, doctor, from what they're pouring through their arteries every 4 hours. And consider me the scout from the front lines sending the message back to the troops. It's the food. It's been the food all along. And that's what Moving Medicine Forward is trying to get across, because otherwise the doctors like the blind man and the elephant, and each specialist is treating their own little disease. But the truth is they're all treating the same disease. They're all treating their patient's diet. And a plant-based diet will deliver true health. So last slide. A new era in healing is open to all of us, and it begins with recognizing the power of the foods on our plate. The plant-based wave is breaking. Line up your surfboard. Start eating plant-based. The healers in this room start utilizing the power of plant-based nutrition. Medicine will get fun, your patients will get healthy, and this whole world will become more peaceful. So thank you for the invitation. Thanks for your attention. I wish you a long, healthy run.